Independence Blue Cross and Independence Blue Cross Foundation are committed to recognizing and supporting the contributions of nurses to keeping our communities healthy. To hear more about their leadership on this issue, we're now joined by Reverend Dr. Lorina MarshallBlake, President of the Independence Blue Cross Foundation and Vice President of Community Affairs at Independence Blue Cross. Lorina is an honorary fellow of the American Academy of Nursing, and under her leadership, investing in the education and professional development of nurses has been one of the foundation's top priorities. Lorina?
Great, thank you so much. Again, good afternoon, everyone. Hopefully you don't have Zoom fatigue by now, but this is the best way we can connect and learn from each other right now. Again, I want to thank Dr. Fuchs and Dr. Mason for their outstanding presentation. And again, thank you to NIHCM. It's always, I've been here before, but it's always a privilege to work with your great organization. And I'm really, really excited and honored to be a part of today's session, the first in the new series, Healthcare Workforce 2021. Again, by launching this series at this time, I think NIHCM shows that you really have your finger on the pulse of the times. And when I hear Dr. Fuchs and Dr. Mason talking how all the different challenges and what nurses are going through, it's just so, it's just imperative that we have this discussion. But for the past year, our frontline, when you look at it, and it's been mentioned again, our frontline healthcare workers have fought the fight against COVID-19, and that they've put themselves and their families at risk for us and our families. So many of them, too many, I believe, have sacrificed their health or even their lives. Again, looking back at the slides, talking about not enough PPEs, you know, nobody really caring or hearing the voice of what nurses have to say. Again, I think we need to talk about how to rebuild our healthcare workforce after such a challenge. And again, with nurses leading, not only are they on the front line, but they're leading the conversation, they lead the discussion, as I was listening to the presentation that was just before us. It shouldn't be just nurse just for a day. It should be nurse every day and hearing their voice. So NIHCM has stepped in, I believe, to help lead the conversation. And their first topic is dear to me and my heart and everyone at the Independence Blue Cross Foundation, nurses. And the reason I'm here is because Independence Blue Cross and its foundation, we're celebrating our 10th anniversary, have committed to supporting the nursing workforce. And again, it didn't just start. Independence has been supporting the nurse workforce since 2004, but the foundation came into effect in 2011. And we believe that nurses are the foundation of a responsive, compassionate, and sustainable healthcare system, and that there's no way to do anything without nurses. So Independence to date has invested more than $24 million over 16 years in education and professional development for nurses. Today I'm going to talk a little about what we think should be the priorities in supporting the nursing profession, and then later if we have the opportunity, we'll do the Q&A. Our first priority that we're looking at, and it's come to the fore and has been around for a while, but really is front and center, is to ensure there is a pipeline of qualified and culturally competent nurses. Okay, recently I just finished a 3-year participation with NACNIP, the National Advisory Council on Nurse Education and Practice, where we just came out, if you get a chance, the 20th report, their 17th report, preparing nurse faculty and addressing the shortage of nurse faculty and clinical preceptors. Again, the conversation about shortage of, I mean, it's real. Again, it may depend on where you are, but if you look at what has happened with COVID and the pressures, the stress it has placed on the whole nursing force. Again, we have 10 years ago, NACNIP did a report and talked about the shortage, and it is now 10 years hence, and there's still a shortage because folks are retiring. Again, they're stepping back from stress. Again, academia is not paying as much as the clinical. So again, you've got all those pressures that are surrounding that. So we need to promote nursing. and open up opportunities to as many people as possible. At the foundation, we award funding to nursing programs in our greater Philadelphia, and you go to the next slide, to our greater Philadelphia region for undergraduate, graduate, and doctoral scholarships. Our funding has provided more than 3,000 scholarships across more than 20 nursing programs. And we have a footprint in Philadelphia, but we are in Montgomery, Bucks, Delaware, Chester, and Philadelphia County, and we support all 20 nursing schools within our footprint. We also developed an innovative model to help prepare future nurses to deliver care in our community. Over the past 16 years, our nursing internship program has given hundreds of aspiring nurses the chance to work at community health centers or in health center administration settings while they were still in school. And the beauty of that, I got excited. I'm audacious enough to believe by the opportunity for our students to then be in the health center, that, and there are 50 of them, that they get the opportunity. They then come back and say, oh, I want to be a public health nurse, had not considered it, and really boots on the ground and making a difference. And again, as nurses come to the fore with their, again, compassion and caring, but they have the skill sets to do the work, and not just bedside community health center, but even in the boardroom. And because, again, we know the value of real-world experience, and that's why I love these internships for people entering the healthcare workforce. This past summer, I had 30 nurses, undergraduate nurses, that did it virtually, and we still were able to add the clinical in too. It was a challenge, but we were able to do it. But our internship program also emphasizes innovation and leadership in nursing. 4 of our former nurse interns received the President's Engagement Prize from the University of Pennsylvania, which is a $100,000 prize to develop and implement programs to improve the health and well-being of the community. Another former nurse, and this was just within the last week or two, intern recently launched, it's called Lumified Care, an innovative solution to provide light to nurses without disturbing sleeping patients. He was just recently featured in the New York Times. So, of course, he was one of our interns, so we've claimed him, we've talked to him, so it's like I'm like a proud mother. Another priority, especially now, is to support the health and well-being of nurses so they can continue delivering care to their patients. Again, we look at burnout. We look at the fact that there's stress. Again, you don't have enough equipment. You know, you have more patients than you ever could have. Because even before COVID, and I'm going to say, and it's been borne out by both presentations, even before COVID-19, it wasn't easy being a nurse. So our focus on nurse well-being started with a study and partnership, and this was recently with Villanova University, to learn how the opioid epidemic was affecting ER nurses. And what they found was that those nurses experienced high levels of burnout and secondary traumatic stress that leads to compassion fatigue and influences the delivery of care to patients with substance use disorder. But moving forward, we hope to expand on this to learn more about the effects of COVID-19 on nurses. And again, you saw the studies that have been done, and that's why I said I was excited when I saw Dr. Mason's information. I said, there's some opportunities. I think we have to look for opportunities with major organizations that we can partner and do some different things. And again, to provide engaging solutions to address their mental health and well-being. Everyone is stressed, and it goes back to, again, mental health and well-being and showing up ready to do the work that you need to do. But if you're burned out, that makes it very hard. This research that we did with Villanova helps us support nurses now and develop effective models to educate the next generation. So again, we didn't know, but we went to those who were right on the forefront. You know, again, when I look at the health centers, we support 50 health centers. All of them are nurse-led. So I often joke, my joke is not, is there a doctor in the house, but is there a nurse in the house? Another priority is to help good nurses to become great healthcare leaders and scholars. Nurses do amazing work in the hospital room and the operating room, but we also need them in the boardroom and the classroom. And I think, again, the voice of the nurse on every level. And it can be hard to prepare for leadership when you're in such a demanding day-to-day job. At Independence, what we did, we launched a campaign called Nurses Can that features nurse leaders who are role models in research, in innovation, in public service. So again, Dr. Fuchs, as you were talking, I was thinking of that brochure that we created that highlighted those different areas, but not nurses can't, but nurses can, and nurses can be anywhere. We also developed a national partnership with nurse.com to develop continuing education content. We support community-based research projects by graduate students that have the potential to transform healthcare delivery. As a matter of fact, we were one of the inaugural funders of the Robert Wood Johnson Foundation's Future of Nursing Scholars program. We had 8 PhD scholars, which supports students pursuing a PhD in nursing. The final priority I want to discuss probably is one of the most important. How can we help nurses lead the way in delivering culturally competent care to today's diverse patient populations? Again, we've heard some stats and another one. According to the CDC, cultural competence is the integration and transformation of knowledge about individuals and groups of people into specific standards, into policy, into practices and attitudes used in appropriate cultural settings to increase the quality of service. And again, I think it comes back to, again, that word attitude. And when you look at attitude has 3 things that are part of it. One, it's crucial to everything we do, whether you're in healthcare, whether you're in engineering, your attitude is crucial. Then secondly, it's a choice. So, people make the choice or how they're going to respond. And then hopefully, if it is the right attitude, that it would be contagious and it would catch on like wildfire. Now, when I say culturally competent, why is that important? Because we know the healthcare system doesn't work the same for everyone right now. And I don't think I have to go into that. But we already see what the inequities are. We look at health equity, whether it's preterm babies, maternal health care, whether it's diabetes, whether it's high blood pressure. We know that exists. We know there are racial and cultural disparities in care and outcomes. For example, African Americans are 60% more likely to be diagnosed with diabetes and 40% more likely to have high blood pressure. COVID-19, and I think, again, we probably join each other on this, has made these disparities even more stark. And healthcare has been part of the discussion of inequality since the George Floyd protests. Nurses can be leaders in advancing health equity. Dr. Mason talked about messengers. And I have a saying, trusted messengers with trusted messages. And I believe that's what nurses are, because they're on the forefront. They're on the front line. And they, as already been said, they are trusted. They are a known commodity. There's no question when it comes to nurses. Now, the first person, I don't know if you saw it or not, in America to receive the COVID-19 vaccine was Sandra Lindsay, a nurse at the Long Island Jewish Medical Center. As a nurse and Black woman, she wanted to inspire people who look like her, who might be skeptical of the vaccine. And again, nurses on the front line leading, it's okay. I've been able to do that. And especially in communities of color, in the African-American community, there's that tendency with regard to, is the vaccine safe? Should I do it? Shouldn't I do it? There has been such a history of how vaccines have been used or tests that have been done. So again, I believe, again, nurses, and when we talk about nurses on the front line, it is about leadership. It is about stepping forward. It is about having a voice. It is about going back to where Dr. Mason was talking about, in other words, it shouldn't be an afterthought that you have a nurse. speaking out or interviewing, you should automatically have a nurse. And again, I got excited as she did when they finally got a nurse on the COVID task force. Now, our foundation is supporting also grassroots organizations who are addressing inequitable access to COVID-19 testing and vaccines. Matter of fact, I don't know if you probably saw it on the news, we were one of the first funders, and we continue to fund the Black COVID doctors who did over 4,000 vaccinations this past weekend from Friday at 12 until Saturday morning at 12. Again, making sure the funding is there. In addition to, there's another group for the Latino community called CATE, Community Access Testing Experience. And I was with them yesterday in a Latino neighborhood doing COVID testing and education. Again, it's getting the education about COVID and getting rid of the myths that are out there, and also about the vaccine at the same time. But again, for the Black and Hispanic community, we are right there on the forefront. And then I would be remiss if I didn't talk about, as we get future nurses into the pipeline, our nursing internship program, which is committed to ensuring young nurses are prepared to care for diverse communities. Because I mentioned, they go out into these 50 health clinics, and the clinics are in the community. We lead professional development sessions for the students that focus on issues related to diversity and cultural competency. Again, we do our session, but again, it needs to be in curriculum. It needs to be something that is practiced often. Our internship sites, like I said, include community health centers in medically underserved areas. And again, they often serve diverse communities, including Hispanic, Latinx, African American, LGBTQ. So again, making sure that we touch those populations who right now have no voice really and are underserved. But early exposure, like I said, to these environments can help increase the number of nurses in communities that need them. It can also reduce the risk of burnout that is often experienced in underserved settings. We are proud of this program and the bridge it provides. And I think that's what it is. We have to provide the bridge for our future nurses to get across. We have to expose them to those settings that are out there, the other opportunities that are there, from academics, which is great, but also to the community. In this issue, like in so many others, nurses can show us the way. As long as we make sure they have the right preparation. I think it's all about the prep time. It's all about being prepared. So I hope, again, I've made the case that the stakes are really, really, really high for us to get nursing workforce development right. And we need to get it right. And the time to get it right is right now, especially, I believe, after a year that was so difficult on the healthcare system. And is it going to be easy? No, it's not going to be easy. But I know that the best minds, and they are nurses, are working on the problem, beginning with this group today. Again, it's been a pleasure to speak to you, and I look forward to questions. And again, thank you for the opportunity of presenting.
Thank you so much, Lorina and Independence Blue Cross Foundation, for your leadership preparing the next generation of nurses to care for diverse communities.